Welcome back to Capital Connections. Now we're going to turn to Governor Kasich's opinion on Social Security reform.
Well, look, I mean, for somebody on it, we have to make sure that they are protected. And for those that are close to getting on it, that's the same. And thirdly, you know, the baby boomers are probably going to have to start at a lower level. There'll be some changes. And the young people, I think ideally what you really want to do is allow them to have the normal Social Security, but also have a little percentage of private accounts like federal employees have, where they can be invested in the economy. Of course, we have to keep it strong. I will tell you that it will not be fixed overnight. I mean, we're going to, again, have to get on a roadmap. See, with most things in life, you didn't get here overnight, and you're not going to get out overnight. You know, if you've gained a lot of weight, you're not going to lose it in a week. In fact, I wouldn't even suggest you do that. You know, you gained it over time, you lose it over time. And the same is true with Social Security. So I have some really good folks working on this, looking at options, but I will also tell you that you cannot fix Social Security unless both parties agree to do it. Now, when we had the last balanced budget, we changed Medicare and Medicaid, and nobody heard a boo. You know why? Because both parties were involved in fixing it. And when both parties get involved, then you're not subject to demagoguery. And the minute the demagoguery starts, some politicians will head for the hills. So we've got to make sure that as we develop a plan, we keep in mind something that's practical, that can be done, that can gain bipartisan support.
After Social Security, Governor Kasich took a question on border control and immigration policy.
You know, it's like your home. People just don't walk in and out of your home, do they? In my home with two 15-year-old daughters, I swear we have a lot of people that just walk in and outside of our home. But in most cases, you want to be able to control who comes in and out, just like a country. See, I come from a blue-collar, conservative, common-sense Democrat town. Things are fairly simple for me. I mean, they're complicated, but the fundamentals are simple. You've got to control who comes in and out of your country. You just can't have people waltzing in here. So we have to control the border. Now, when we do this time, we have to tell people that if you come across again, you're going back. No excuses, you're going back. So don't try. If we catch it, you're going back. Period, end of story. But then we have to have a guest worker program so that people can come in and work and then go back to their country. That's fine. And then for the 11 or 12 million that are here, we want to find out who they are. If they've been engaged in criminal activity, they either go to prison or they get deported. And if they're law-abiding here, they're going to have to pay a penalty and assimilate and, you know, and probably take some time. But ultimately, I think they ought to become legalized in our country. And that's what I would do. And then we got to look at the whole immigration system, the way we do visas and all that. But I think that's the sweet spot. I believe that can pass the Congress. I believe that's something that the American people would support because it represents common sense. We are not going to start driving around in our neighborhoods trying to find people, put them on a bus, drive to the border, and yell at them to get off. I mean, that's just not practical. Now, what I've just told you may not get a lot of applause, but I'm not in this business to get a lot of applause. I'm in here to try to come up with practical solutions. And with that, we would have our border controlled. We'd have a more rational system, both from guest worker, both from, you know, what I've talked about on legalization. And you may be able to get that passed in the Congress. But we got to get this border protected, okay?
Following immigration, he was asked a question around health care and health care policy.
The problem with Obamacare is it doesn't control, as you know, the rising cost of insurance. So first of all, the one good thing, the one good thing, okay? I didn't say two, I said one, one. Is it eliminates pre-existing conditions so that if you get sick, there's nobody in America that doesn't think we should do that. But to me, the answer is not this government top-down raising health insurance. It's raising health care costs, just the opposite of what we wanted to do. So here's what we're doing in Ohio and something that I think should be scaled up nationally. We believe that our primary care physician ought to be the shepherd to take us through the system when we need health care. So our primary care physician would be incentivized by the market to try to make sure that we get quality care at lower prices. There ought to be great transparency. How do hospitals perform? What do they charge? What's the readmission rate? What about physicians? What are the prices? Let's have total transparency so we can have a better way of choosing. And then, in addition to that, you know, if you go to the hospital today, you may need 2 tests, but they give you 10. And you really don't care. And first of all, you can't even understand what they're charging you for anyway. But somebody else is paying. Now, this is why costs continue to go up. We practice quantity-based medicine, not quality medicine. So what we believe we should do is everybody should be rewarded for keeping us healthy rather than be rewarded when we get sick. And I'm going to give you one perfect example of this. The Children's Hospital in Columbus has a protocol to keep children out of the hospital who have asthma. You know that childhood admissions for asthma is high. Are you aware of this? Yes. So it costs a lot of money. It's not good for families, not good for the kids, not good for anybody. Maybe sometimes kids have to be admitted. But if you have an incentive to not admit them but yet keep them healthy, okay, you don't need to be in the hospital, young man or young lady. We can keep you healthy. You don't need to be admitted. The hospital gets less revenue, right? Fewer people there. The insurance company makes more money because they don't pay any claims, right? So guess what? We're getting the hospital and the insurance company share the benefits of that kid staying healthy. Now that's the way it ought to work, and scale it up to a bigger degree across the country. So I think that's the direction we ought to head, and I think we would end up over time stabilizing healthcare prices, having better approaches to quality, and changing from a quantity system to a quality system.
After the break, we're going to present Governor Kasich's opinion on the middle class, education, and tax policy.